This interview is brought to you by NTT Data. NTT Data delivers on your mission by combining superior talent and over 55 years of government expertise with a comprehensive portfolio of technologies from cloud, security, and consulting to modernization and IT solutions. We're your ideal partner for reimagining your healthcare IT. Visit nttdataservices.com.
We're here at HIMSS with HIMSS' very own Lee Kim, as she's Senior Principal Cybersecurity and Privacy. Nice to have you. It's so great to chat.
Hey, thank you.
So what are some of the biggest trends you've seen impacting healthcare that is informing broader technological conversations?
I think I'd be amiss if I weren't to talk about artificial intelligence.
Sure.
That's absolutely top of mind. But secondly, also in light of the big change healthcare breach, I think we can't step away from the fact that we're all very interconnected and we need to think about what we're doing in terms of business continuity and DR, disaster recovery, plus our tabletop exercises, like
Sure.
How do we respond?
Yeah, absolutely. Where are you seeing some of the most fruitful collaborations between private and public sectors in regard to cybersecurity and some of these data privacy priorities?
Okay, I'm going to mention two of my favorite things. One is InfraGard. Full disclosure, I'm a director with InfraGard Northern Capital Region based out of DC,
Okay.
but it's a free way that people can join the local chapter and partake of threat intelligence at the unclassed level
Okay.
and understand what's going on cross-sector. But the second thing as well is, and again, I am a part of it, so I guess you can say I'm a little bit biased, but it's good for all. And that is, I'm a volunteer with the DHS Analytic Exchange Program.
Oh, nice.
And it's been happening for many, many years, over 10 years. And we get together in terms of public sector and private sector, and we essentially publish at the end of 6 months a deliverable on a critical infrastructure and national security topic of choice.
Wow.
This year I'm on the maritime cybersecurity team, but that kind of keeps me sharp in terms of what the latest and greatest is in terms of how do we look at cybersecurity again, and what can we learn from the IC to private sector to the IC, and again, share that information by way of a published paper through the DHS AP website.
Absolutely. Maritime has been kind of a rising focus area for cybersecurity. Why is that?
It's because, okay, let me summarize the paper that we just published. And that is, unfortunately, we have some countries like People's Republic of China and others that are getting more and more ownership over ports.
Mm-hmm.
And so, while I can't say, of course, that we're necessarily staunch adversaries, there certainly is some kind of conflict. Mm-hmm. And that's a concern over whether things are U.S. controlled or not, over our ports and things like that. And the other factor as well is in terms of things relevant to supply chain and the manufacturing of our cranes. They're switching over to Japan. That's essentially the sum and substance of a wonderful executive order that the Biden administration just pushed through.
Sure.
And I'm very happy to say that, it just makes us stronger and more secure here in the States.
Absolutely. Pivoting back over to the healthcare side, what are some of the challenges facing healthcare practitioners and technologists when they're trying to really work together?
I'd say number one is visibility. Healthcare practitioners sometimes are involved in these incident response tabletop exercises, but a lot of the time the security team kind of walls off everything in terms of what's actually going on, how healthcare providers can engage and report incidents. But as on the government side, what's really good on the government side is incident response and those TTXs, the tabletop exercises. So I would say what we could do, just sort of taking a page from government over to the private sector, is we need to involve all kinds of stakeholders, even those that aren't critical to a security team, but that make a heck of a difference in terms of patient care or even back-end operations, so that everyone knows what to do. It's all hands on deck, and so that kind of in line with what government does, there's a clear chain of command of who does what, what's your call tree, what happens if someone's not available, etc. So that's certainly a clear call to action, I think.
That's actually very interesting. You never hear taking a page from government. Usually it's the other way around. So to know that government really has some of these things, in place that a lot of others can learn from is interesting.
It is. I mean, I have to say, just having the privilege of volunteering with DHS AP, it opened my eyes to the good that government is doing, how intelligent and what a different perspective it is, even at the unclassified level. And that, I think, that's why those public-private partnerships that you spoke about is so vital, so that we can get together and learn, information share, and do better, and each side can contribute knowledge, resources, and know-how.
Sure, absolutely. So taking into account being here at HIMSS, what are you looking forward to at this conference and learning more about?
I really take joy in connecting with our volunteers. I know some of them, some old, some new, and it's just fun to try to connect with them to other people that they should be talking to, that they may want to talk to. I'm totally always happy to help people out. And also education. I mean, we have the best education there is in the sector, and it's very forward-thinking, and we're all here. There isn't a single vendor that isn't a major player in the space that is not here. There are just so many healthcare providers, large and small, just gathered together. And that's what it's all about. It's about people doing problem solving, even in the age of AI, right?
In the age of AI, I mean, that's the biggest theme here this year, I think. So
yeah.
How do you see cybersecurity really evolving in the age of AI?
So there's this thing called machine-to-machine communication, right? As opposed to you and me, it's human-human, of course. But because with AI, these attacks are driven, not necessarily more deep, innovative attacks, but more like faster velocity of the same kinds of attacks that we're used to seeing in the threat space. You can only defend against AI if there's an offensive AI, we need to meet it at that speed in the same way with defensive AI. So I think that healthcare providers and others just simply need to get on the same level and sophistication so that they have similar tools. And last but not least, again, sort of saying, hey, government, I'm a fan. I'm not an employer or contractor at all. Essentially, I would say, let's teach, train, and test our resources as rigorously as government does. So my colleagues, IC or otherwise, they train even weekly. Why can't we do more?
Yeah.
Private sector.
All right. Well, thank you so much for standing with me and chatting more about some of these things. It's always fascinating to hear what's going on at HIMSS, and the cybersecurity landscape is evolving fast, and it's interesting to hear your perspective on it.
Thank you. Most of all, it was fun, and I hope that everyone realizes in healthcare, the beauty of what we have is that we want to help people.
Yeah. Thank you.
Thank you.